dentist recommends scaling and root planing. Bet we can guess your first question. What is scaling and root planing? Well, glad you asked. It's a non-surgical, deep cleaning procedure to remove plaque below the gum line, where regular brushing and flossing can't reach. How is it different from a routine dental cleaning? It's a little more invasive, and it's actually performed by a dentist. What's the biggest benefit? It can help stop severe gum disease from progressing. But that's not all. It can also lead to less frequent bleeding of the gums, reduced risk for tooth loss, protection from infection caused by plaque and tartar. It can even reduce the side effects commonly associated with gum disease, like bad breath, swollen gums, painful chewing, or teeth sensitivity. Is it going to hurt? Not as bad as ignoring periodontal disease will. We know what you mean. Don't worry. Your dentist will use a local anesthetic to help with any discomfort. When you have gum disease, your teeth need a little extra attention. Scaling and root planing is a good way to get the extra care gums need to get better. More questions? Give us a call or book an appointment today.